Okay, so Dr. Mendenhall, I wanted to ask,
Mhm.
why was this study important to complete? With such
Um,
focus.
yeah, so the study about trauma, thank you. The study about trauma over the life course.
Yes.
Yeah, so, gun violence. And this was, I think, around 2012, right? So even now, before the numbers started to increase, just the high cost that gun violence was having in communities on the south side of Chicago. We especially did our study kind of like in the Inglewood area.
Okay.
Yeah, and just the cost on both mental health, and then also looking to see how it affected Black mothers' physical health as well.
Okay. And why are Black communities, why have they been so prone to gun violence?
Well, I don't think they're prone to gun violence. I think it's the structural oppression, right, that leaves them, right, segregated them in communities without, access to jobs, with the schooling, right, often doesn't allow them to transition, right, to higher education. And those factors lead, many of those factors are some of the root causes of the gun violence.
Mm-hmm. Mm-hmm. And
Like lack of economic opportunity, not having the housing that you need, not able to feed your family.
Because oftentimes, what have you heard as being a reason for somebody maybe robbing another person or shooting somebody,
Yeah, I would say those things like again, kind of like the rage that you see from not having the access to the resources that you need to survive and let alone thrive. And also, right, some of those things facilitate the drug trade. And that's a part of it. But I would say overall, just the structural oppression and being left out of the resources that are provided to others in society.
Okay. And I know the study is more Chicago focused, but how could this study relate to Champaign, given Champaign has been having a high shooting rate?
Yeah. I think really recognizing trauma and how it impacts individuals, and how many individuals have it, trauma as children, and then it kind of influences health and wellness as adults. And I know in Champaign, right, we're working both at the university and with the city council and others to try to think about trauma-informed approaches and bring in resources in those areas that I talked about, right? Resources around housing, resources around employment. The University of Illinois has free tuition for individuals whose parents make under the median income. So it's relevant for here, Champaign-Urbana, because, right, we are seeing the gun violence, we're seeing the trauma that it creates, not just for families involved, but for the whole community. And we're coming together and saying, okay, right, how can we address this? What resources do we need to invest in trying to decrease the violence?
Absolutely. Now, I did read that with constant triggers of stress as a result of the ACEs, it really does something to the body. So tell me how that trauma has a physical effect on one's body.
Yeah, like when you're encountering trauma, you often elicit the stress response, right? So you have these hormones that are raging through the body that if you're constantly in the fight or flight, you then tend to create wear and tear on the body. And so then a lot of times it's associated with diabetes, with hypertension and other things.
Okay. And I like how you mentioned how Black communities have historically been shut out with advancing as a community. That really added a lot of context, because some people would be like, well, other people suffer from gun violence. True. But not to the extent of black people. And what have you noticed throughout history that black people have suffering from? I mean, obviously we both know the answer to that, but what did you find the most interesting aspect that has led to your findings?
I mean, a lot of it is racial trauma and, of course, the intersecting aspects of it around class and gender. But as you mentioned, right, African Americans have had over 400 plus years of racial trauma in the U.S., from slavery to Jim Crow, right, to many people moving north and then hitting redlining, right, or hitting the black belt. Initially, where even if you were black and middle class, you still couldn't move to different neighborhoods. And again, when the factories started closing down with deindustrialization, then many African Americans didn't have the living wage jobs, especially if you didn't finish college, right? So all of that is just kind of declining conditions of African Americans.
Absolutely.
And again, rooted in racial trauma, rooted in racial segregation, rooted in segregated schools. Even Chicago public schools, right now, it's overwhelmingly black and brown students who are there, right? After Brown versus Board of Education, right? We're kind of seeing intense segregation again.
Absolutely. And I like how you said it has a historical tie to it, rooted in segregation, rooted in slavery and all of that. And that is what caused people to not get good paying jobs, and therefore that means that they couldn't afford to get proper health care, whether it be for the actual trauma that they faced, from a therapy aspect, or just the struggles that they've been suffering with, maybe not eating the best, perhaps, because
So you're right. Insurance is often linked to having a job, right? So if you don't kind of have that job, there are some insurance options through the government, but often, it's for the most part tied to your job. So that's critical. And then, we often have food deserts in communities of color where you have to travel significant distances to get your fresh fruits and vegetables. And so one of the things that we're working on in Chicago with the MacArthur Project is to train these community health workers, right, who have knowledge around this is how you manage like the chronic diseases of diabetes, hypertension, but this is also how you prevent it, right? Like, and here's the fruits and vegetables. And, in the summer, Chicago has lots of community gardens. We're going to work on how can people grow some of the fruits and vegetables in their own home so they can have that year round. So trying to look at both the historical causes, how it's playing out now, but then also what are some solutions? We don't have to continue to be in this situation. We can demand change on the structural level, and then there's also things we can do on the individual level.
Absolutely. And Dr. Mendenhall, I love how you are, tying this to it being a structural issue, because, they oftentimes point the finger at us as if we're just these savages with firearms, when
right.
Because what would you say is another reason how people are able to get these guns in their hands, like just to actually physically have a gun and be found by a young male, a young woman in the black community? What have you heard?
So a lot of people talk about the gun laws that we have, and the time to wait to get the gun, who is able to have a gun. And many people have been pushing for tighter gun control laws, and others have been lobbying for just the opposite, right? So that's a big part of it too. And even the type of guns, right? The type of guns that can fire multiple rounds and injure people very quickly is easily accessible, unfortunately.
Mm-hmm. Mm-hmm. And in your findings, were you able to find a source of where they might come from, or that it's just an unknown detail at this moment? Because
we didn't look at that in our studies.
Okay.
We didn't look at that.
Okay. Well, thank you, Dr. Mendenhall. I appreciate you for calling me back.
Yes. Well, thank you. Very nice talking with you.
Absolutely. All right. Okay. Take care, Dr. Mendenhall.
Bye-bye.
All right. Bye-bye.